They are very significant, and no woman should be afraid to complain about them. It's not something to be ashamed or embarrassed about, because we have a lot of options that we can now offer each and every woman to help her through the menopause journey and to help to alleviate symptoms.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Zoe Mernier, the editor of Prevention. Thank you for joining me for episode 3 of season 10. Today on the podcast, we'll be revisiting some symptoms that are basically synonymous with menopause. Think menopause and you think these guys, namely hot flushes and night sweats. We haven't discussed these since way back in season 1, but since then there have been some exciting discoveries and changes in available treatments, so it's certainly high time for a revisit. To guide us through, we're joined today on the podcast by Professor Rodney Baber, Clinical Professor of Obstetrics and Gynaecology at the University of Sydney and former President of the International Menopause Society. Professor Baber, thank you so much for joining us today.
It's a pleasure, Zoe. Very nice to be here.
Okay, well, let's just start with the basics. What are hot flushes and night sweats?
Hot flushes are sudden sensations of heat which arise in the centre of our bodies, so chest, neck, face. They can last from a few seconds to up to a minute, and they can occur from 3 to 4 to 5 to 10 to 20 or 30 times per day. If they occur more than 7 times a day, they're generally regarded as quite significant. And they're there because what happens at menopause is that the thermoregulatory centers in our body, which control our temperature, become disrupted. And this is the way the body deals with that extra heat. It causes us to flush or sweat to get rid of the extra heat.
Right. And basically night sweats are pretty much the same thing as a hot flush, but they just occur at night.
Yeah, that's right. Hot flushes can be present on their own, or they can be associated with sweating, because that's another way to get rid of the heat. As the sweat evaporates, it cools us down. And sometimes also with other symptoms such as palpitations.
Okay. So how do they happen? What causes them?
Well, it's a very good question, because for a long time we didn't know. But we do now understand what happens. In the brain, in our hypothalamus, we have a set of neurons called candy neurons. That is KNDY neurons.
Right.
They're named like that because of the neuropeptides which they produce. And at the menopause, when estrogen levels in a woman's body drop, those neurons get bigger and they produce more of those peptides that they produce during reproductive life. So in other words, estrogen in a woman's reproductive life controls and to some extent limits the production of the neuropeptides from this neuron, the candy neuron. What happens at the menopause is there's a particular increase in the N of the candy, neurokinin. And neurokinin in excess transmits to the thermoregulatory center, also in our brain, and it disrupts it. And that's what causes the hot flush.
Okay. Well, yeah, I think that's kind of interesting for people to actually know what is going on there, because it can be, it can be quite upsetting just to sort of have this thing take over you, right?
Absolutely. Absolutely. I think they're terrible things. And when I teach medical students or trainees or even family doctors, I say to them, this is not something that's trivial. This is something that is incredibly disruptive. It can disturb, certainly disturbs quality of life, but it can also disturb sleep, it can disturb relationships, and it can disturb work.
Absolutely. Now, I said before they're kind of synonymous with menopause. So how common are they exactly for menopause?
Unfortunately, they're very common. About 80% of women who go through the menopause will experience these symptoms to some degree. And we know that about 1 in 3 of those women in Australian societies or other Western societies experience them in a moderate to severe way. So that is more than 7 flushes a day and enough to disrupt their daily activities. So that's about 25% of women going through the menopause. So it's a lot, Zoe.
Absolutely. And do we have any sort of understanding of why some women get them so severely, some don't get them at all. Why there's such a discrepancy? One of the life's great mysteries.
Look, you could win the Nobel Prize for that. We know there are differences between ethnic groups. It's not true that Asian communities do not get hot flushes, but there is a difference between the extent to which hot flushes are experienced in Caucasian communities compared to Asian communities or African communities. So there's some difference there. There's a difference between individuals, which points, I think, to the fact that there are genetic mechanisms involved here, and that's most likely going to be what we discover over time, that there are genetic variants that predispose some people to more severe flushes and perhaps even to flushes that persist for longer.
Absolutely. That's very interesting. Because, as you say, we are just still learning so much about them, aren't we?
We are.
Now, interestingly, there is kind of a specific name for these now, if people want to get technical as well, isn't there?
Yes, it's vasomotor symptoms. That's the term which is used to describe hot flushes and night sweats.
Or we call it VMS for short, right? So I can sound
VMS for short.
Very
right.
professional when I say can VMS due to menopause ever actually be dangerous to our health? And we know that it's uncomfortable, debilitating, can affect quality of life, but is there ever a point where it can sort of jeopardize our health in any ways?
Well, it can be a signal, Zoe. A lot of this work has come out just in the last few years. But, for example, we know from follow-up of the Women's Health Initiative randomized clinical trials that were concluded in the early 2000s. And so we now have 20 years of follow-up on those. We know that women who experienced hot flushes more severely than others were more likely to have low bone density and were more likely to have an increased risk of vertebral fracture. So hot flushes on their own are associated with an increased risk of loss of bone density and an increased risk of fracture. A study of women across the nation in the United States was also able to show that women who experienced hot flushes, particularly if they came on early in their late 40s or early 50s, had an increased risk of cardiovascular disease. And that risk wasn't associated with the estrogen levels in their body. It was attributable mainly to the presence of those hot flushes.
Wow.
So it's quite significant. And of course, as you can imagine, if you have a lot of flushes, it does affect sleep, and that in turn will affect mood, and it's therefore more likely to be associated with depression.
Yes, absolutely. That's a very strong correlation for sure. Now, do we also have any sort of indication of why they last, for as long as they do, or why or when they stop? Because there's obviously an expectation that hot flushes will sort of end not long after we reach menopause, but that's not always the case, is it?
No, it's not. It's not. The whole thing is quite confusing, particularly confusing for women going through it, because when they go through the perimenopause, which is when their periods start to become irregular and before their last period ever, they do experience hot flushes, sometimes quite badly. And then they'll go away, and that's because their estrogen levels have come back to normal, and they think they're through the whole thing. Then they come back, of course. So we know that overall flushes generally start before the last period, and on average will last for about 7.5 years. But for some women, it's less, of course, and for others, it's 10 years or more.
It's a long time.
Now, it's not very nice.
No, absolutely. We'll be right back after this.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
Okay, we're back. Obviously, given all this, it's not surprising that women would be wanting to know what they can do about it to absolutely lessen its impact on their lives. So, first and foremost, how successful can lifestyle changes be to reducing symptoms?
Well, they can be helpful. And I think I 100% understand that this is something that women would like to do for themselves. And I think they should be applauded. Lifestyle changes can make a difference. A loss of weight will make a difference, of course. Modifying diet can make a difference because you can avoid things that might trigger the flushes. Just dressing differently for a while, wearing layers so that you can put things on and off fairly easily, are all useful modifications. There's a lot of other things that we do that we should do more of, including exercise and yoga and paced breathing, which are great for us, but unfortunately have been shown to make no difference. But certainly those other simple lifestyle measures are very helpful, not only in reducing the frequency of the flush, but also reducing the severity. And if you can get that severity down to a stage where you're having a hot flush, but it doesn't stop you doing what you're doing, then that's actually quite a significant achievement.
Absolutely. And what about alcohol? Is that something that has an impact?
Yeah, because alcohol vasodilates, it's quite common for people to have a few flushes after a few glasses of alcohol, then it will certainly be more likely to trigger hot flushes.
Sad but true.
Pretty
All right.
depressing, isn't it?
Yes. Now then, of course, there's the option of menopause hormone therapy. How does this work on VMS symptoms and how successful is it?
It's the most effective treatment we have. That loss of estrogen at the menopause is what causes the candy neurons to get bigger. So if we can add estrogen back, we can stop the increased production of neurokinin, which is the base cause for the hot flush. So menopausal hormone therapy has been around for 80 plus years now. So we've had a lot of opportunities to refine it, research it, and learn about it. And it's the most effective treatment. It will alleviate symptoms in about 80% of women compared to a placebo group. And at the moment, nothing is as effective as that.
Right, there you go. And now, of course, we have a new treatment available. Tell us all about this and how it works.
I will, because it's very important. Having just said how good estrogen is, we have to remember that some women can't use estrogen because of various aspects of their health. And a lot of women would rather not use hormones. Hormones are very effective, but there's still a reluctance on the part of many women to use them. We now have a new treatment. Now, if you can think back to that candy neuron, what I just said about estrogen is that it stops the candy neurons getting bigger after the menopause. But the new thing we have, the new drug we have to treat it, stops the release of the neurokinin, the N in the candy, which actually causes the disruption. So we now have a new preparation available to us in Australia, which is called a neurokinin 3 receptor antagonist. And when it's taken, it reduces hot flushes by about 60% in frequency and by a similar extent in terms of changing the flushes from moderate to severe flushes to mild to moderate flushes. So it's been proven in a number of clinical trials to be very effective in both those aspects, and to some extent will also help sleep.
Great. And is it something that sort of works for some people and not others, or is it pretty much effective across the board?
No, it works for some. It should work for everybody, of course, but we are limited in the doses that we should be using. And some women will find it's mildly effective. Others will think it's the best thing since sliced bread. And some will unfortunately get no benefit. But it's for most women, it's a very good alternative to try. And importantly, I think when we're looking at treatments for menopausal vasomotor symptoms, then this one has been approved by government regulators. It's been tested, it's been shown to be effective, and we know all about its safety as well.
Okay, and we should tell people the name of it, shouldn't we, in case they're wanting to know that?
Yeah, of course. This new drug is called fezolinetant, but its trade name is Veoza. It's been trialled in over 1,000 women in trials that have lasted for 12 months. And as I said, it's been shown in those trials to be very effective in reducing the frequency and severity of vasomotor symptoms. It's not hormonal, so of course there are therefore no hormone-based side effects. But because it's not hormonal, it will have no effect on bone health or heart health.
Gotcha. And is it safe to keep taking it for an extended period?
Well, the clinical trial data runs for 12 months.
Yep.
So that's all we can say with certainty. But for the duration of those trials, there were no signals during the trial to suggest that prolonged use would be in any way more dangerous than using it for 12 months. More trials are underway to look at other aspects of women's health and, of course, to look at the use of these medications for longer periods of time. There are a couple of warnings associated with it. It shouldn't be taken by women who have severe renal impairment because, as is the case with many drugs, it's metabolized and excreted from our bodies using the kidneys. So severe renal impairment is a contraindication, and also somebody who has abnormal liver function.
Right.
So what has been recommended is that before commencing treatment with Veoza, doctors should check their patients' liver function tests to make sure they're normal, and just test them again after 3 months to make sure there has been no change. Veoza has not been tested in women who have had breast cancer, but the regulators have said correctly that there is no reason to suppose that there would be any problem with their use in patients who have had breast cancer. And of course, that should be assessed on an individual patient's risk and benefit value evaluation.
Absolutely. Okay, well, was there anything else that you wanted to discuss about hot flushes?
We could talk about hot flushes forever, probably. I think the only thing I would say is that they are very significant, and no woman should be afraid to complain about them. It's not something to be ashamed or embarrassed about, because we have a lot of options that we can now offer each and every woman to help her through the menopause journey and to help to alleviate symptoms. And they range, as you have correctly pointed out, from lifestyle changes to hormonal interventions using body-identical natural hormones, and now to a new range of neurokinin 3 receptor antagonists.
Wonderful. Well, thank you so much for all that information, Professor Baber. It was very helpful. So I really appreciate you taking the time to join us today.
Pleasure, Zoe. Thank you for having me.
And listeners, thank you for joining as well. If you liked this episode, we'd love you to rate, review and subscribe. And we hope you'll join us for next week's episode. Meanwhile, for more information about living your best life at midlife, pick up a copy of Prevention Magazine. I'm Zoe Mernier. See you next time.